Hello, I'm Dr. Chris from Center for Health Promotion and Economic Rehabilitation. Today we are discussing the topic stroke and mini stroke. The human body needs oxygen to survive. Every organ or tissue in the human body needs oxygen to survive. And this oxygen is dissolved in blood and carried in pipes to different organs in the body. So if you don't have supply of oxygen, then that part of the body will die. So there's a part of the body which is very important, which is the brain. The human brain is a controller general of every other part of the body. It's the brain that you use to think. It's still the brain that controls the movement of your legs, your hands. Everything is controlled from the brain. That you can see is controlled from the brain. Another part of the brain controls your hearing. Even whether you feel angry, sad, happy, they are all controlled from the brain. You feel hungry, they are all controlled by the brain. So that is how important the brain is. Different parts of the brain control different things. In short, sometimes you can see you feel very hungry, and immediately you see food and eat the food, you feel filled and you become strong again. Immediately. You may argue that what gave you the strength is the food you ate. No, it takes some time, maybe upward of 30 minutes, before the food you ate will digest and release energy. But the truth is that immediately you eat the food, signal is sent to your brain that you have eaten the food and you get energized. It's not the energy from the food. It takes some time before the energy from the food will be released. Or maybe when you are afraid, you in the night, maybe moving in the night, you now see trees, it will be as if they are moving, but they are not moving because it's the signal from your brain. So the brain is very important in human to control other part of the human body. The other part of the human body are controlled from the brain. So and there is blood supply to the brain. So when this blood supply to the brain is compromised, that is when you say the patient, that part, small part of the brain dies. So the side that usually affected is the side that controls movement. So, and you say the patient has a stroke. If the right part of the brain is affected, the limb on the left will be affected. If the left side of the brain is affected, the right side of the body will be affected because the right side of the brain controls the left side of the body, while the left side of the body controls the right side of the brain controls the left side of the body. So it's like that. So when blood supply to that to the brain is compromised, it will lead to the death of some brain tissues, and this is what we call stroke. And what causes the blood supply to the brain to be compromised or disturbed is either bursting of the pipe that supply the blood, which is called blood vessels, or blocking or clogging of the that pipe that supplies the brain. So the major cause of the bursting of the pipe is hypertension worldwide. So hypertension, uncontrolled hypertension, can lead to bursting of the pipe that supplies the brain and lead to stroke. Another thing that can cause blocking, that will cause blocking or clogging of the pipe is cholesterol or fat. When there is high cholesterol or fat in your blood system, it will block or narrow the pipe that supply blood to your brain, and that can lead to stroke. So In the subsequent lecture, we will be able to discuss how we can maintain these pipes or the blood vessels that supply blood to our whole body so that we will not have heart attack, will not have stroke in our subsequent lectures. Thank you and God bless. Like and share.